Adverse drug events have a significant impact on the healthcare system. Let's take a look at some numbers and the impact of some commonly used products in terms of their adverse drug events. The information presented in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. Remember to subscribe to this channel so you can be notified of more pharmacy and medicine-related videos. Medicines are generally safe when used as prescribed or as directed by the label, but there are risks in taking any medicine. An adverse drug event is when someone is harmed by a medicine. Older adults visit emergency departments almost 450,000 times a year, more than twice as often as young persons. Adverse drug events are a large public health problem. Older adults are nearly 7 times more likely than younger persons to be hospitalized after an emergency visit, but most of these hospitalizations are due to just a few drugs that should be monitored carefully to prevent problems. And these include blood thinners like warfarin, diabetes medications like insulin, seizure medications like phenytoin, and prescription opioids are some examples of these medications. Adverse drug events cause approximately 1.3 million emergency department visits each year. About 350,000 patients each year need to be hospitalized for further treatment after emergency visits for adverse drug events. People typically take more medicines as they age, and the risk of adverse events may increase as people take more medicines due to the drug interactions that they may cause. Perhaps the most common set of adverse drug events for drugs that are ingested include gastrointestinal symptoms like nausea and vomiting. For topically administered products, local reactions like application site reactions, like application site rash or itching, may be most common. To reduce the harm from adverse drug events in adults, keep a list of your medicines, follow directions, ask questions, keep up with any blood testing recommended by your doctor, take all medicines only as directed. Getting a blood test is one way to make sure the dose of your medicine is just right for you. More than 40% of emergency visits that require patients to be hospitalized are caused by just a few medicines that require regular blood test monitoring. Examples of common drugs that require monitoring are blood thinners like warfarin, diabetes medicines like insulin, seizure medicines like phenytoin or carbamazepine, and the heart medicine digoxin. Now let's talk about some major classes of medications that have an impact on our healthcare system because of their adverse drug events. Antibiotics are one of the top medication classes, resulting in emergency department visits for adverse drug events. Based on data from 2013 to 2014, each year in the United States, there are an estimated 200,000 emergency department visits for adverse events related to antibiotics. Overall, antibiotics are responsible for almost 1 in 6 estimated emergency department visits. Because of their ADEs, antibiotics are involved in more emergency department visits for ADEs than any other class of drugs in patients under 50. In children 5 and younger, antibiotics cause more than half of estimated emergency department visits for ADEs. About 4 in 5 individuals undergo emergency department visits for ADEs from antibiotics alone due to allergic reactions. From 2004 to 2006, there was approximately 1 in 1,000 risk that a person prescribed an antibiotic would require a visit to the emergency department because of an antibiotic side effect. But it is estimated that there is only 1 in 4,000 chance that an antibiotic would prevent a serious complication from an upper respiratory infection. An allergic reaction is the most common type of antibiotic-associated ADE, so minimizing unnecessary antibiotic use is the best way to reduce the risk of an ADE from an antibiotic. The next class of drugs are anticoagulants. Anticoagulants, or blood thinners, are important for preventing and treating blood clots, but are associated with an increased risk for bleeding. Using anticoagulants safely requires a careful balance of risks and benefits. Among older adults, oral anticoagulants are the most common causes of adverse drug events leading to emergency room visits and emergent hospitalizations. Oral anticoagulants include warfarin and the direct-acting oral anticoagulants such as apixaban, dabigatran, edoxaban, and rivaroxaban. Each year between 2013 and 2014, warfarin was responsible for 32% of estimated emergency room visits for all ADEs among older adults over age 65, and 36% of estimated emergent hospitalizations for all ADEs among older adults. Warfarin, rivaroxaban, and dabigatran were among the top 10 most common causes of ADEs resulting in emergency department visits among older adults. In 2017, bleeding from oral anticoagulants resulted in approximately 235,000 emergency department visits. Older adults, 65 or older, were involved in approximately 80% of direct-acting oral anticoagulant-related bleeding visits and 77% of warfarin-related bleeding. These same products contributed to approximately 40% of estimated oral anticoagulant bleeding visits. To reduce the risk of anticoagulant-related bleeding, carefully follow your doctor's advice about medication dosing, blood test monitoring, and diet, and do not discontinue your medication without first talking to your doctor. Next, let's talk about insulin. Insulin is an important part of diabetes treatment, but it can be difficult for some patients to manage and monitor. Insulin can cause adverse drug events that lead to emergency room visits. From 2007 to 2011, nearly 100,000 estimated emergency department visits occurred each year in the US for insulin-related low blood sugar or errors when taking insulin. Of the emergency department visits, nearly two-thirds of the patients had symptoms of severe hypoglycemia, such as shock, seizures, and loss of consciousness. Almost one-third of the emergency department visits related in hospitalizations. Older adults are most vulnerable to insulin-related hypoglycemia leading to emergency room visits. 1 in every 8 insulin-treated patients aged 80 years or older visited the emergency department for insulin-related hypoglycemia or errors. When compared to insulin-treated adults aged 45 to 64, those aged 80 years or older were more than twice as likely to visit the emergency department for insulin-related hypoglycemia or error, nearly five times more likely to be hospitalized when comparing these age groups. Meal-related mishaps and taking the wrong insulin product were the most common reason for emergency room visits from insulin-related hypoglycemia or errors. Meal planning is a well-recognized component of diabetes education. However, among the emergency department visits with information on what caused the visit, a meal-related mishap was the most common factor in nearly half of the cases. Common meal-related mishaps include not eating shortly after taking rapid-acting insulin, such as insulin aspart or insulin lispro, not adjusting insulin doses when eating less. The second most common factor was patients taking the wrong insulin product, documented in nearly 1/4 of visits with information on what led to the visit. The most frequently reported type of product error was confusing rapid-acting and long-acting insulin products. In these cases, more than half the time a patient intended to take a long-acting insulin product, such as insulin detamers or insulin glargine, both took a rapid-acting one instead. The number of Americans with insulin-treated diabetes has increased in the past decade. It is important for patients to continue working with their doctors to safely and effectively manage their diabetes. Patient education should focus on meal planning and the safe administration of insulin for the safest and most effective care. Balancing the risks with the benefits of diabetes treatment with insulin is now an important component of nationally recognized diabetes treatment guidelines. To reduce the likelihood of hypoglycemia, plan meals and pay close attention to the insulin products administered. The last group of products we'll talk about are opioid analgesics. In the United States, the use of opioid or narcotic analgesics, which are pain relievers, as part of pain management regimens has contributed to a poisoning epidemic. The increase in drug poisoning coincides with an increase in the prescription of major types of opioid analgesics, as physicians were encouraged to prescribe stronger analgesics for pain management. When sales of opioid analgesics increased, the occurrences of opioid analgesics on death certificates increased at a similar rate. In 2013, the rate of drug poisoning deaths involving opioids remained higher than the rate of deaths involving heroin, but the rate of deaths involving heroin had almost tripled in 2010. The overall goal should be to identify ways to reduce deaths from opioids without reducing the quality of care for patients who legitimately need pain management. The CDC Clinical Practice Guide for Prescribing Opioids for Pain provides recommendations for safer prescribing of opioids among adults in primary care settings. I hope you found this video educational and useful. Please remember to like and share. Thank you.